Hi, I'm Dr. Kat with MarriedToPTSDPro.com. I'm a clinical psychologist by education, training, and experience. And I wanted to take this chance to help folks understand the differences between a psychiatrist, a psychologist, LCSW, LMFT, LPCC, alcohol and drug counselors, and a coach. Psychiatrists are medical doctors first and then specialize in psychiatric disorders. I like to have them on board for particularly difficult cases that require medication. Most psychiatrists do not do talk therapy and rely heavily on medication to help folks. There is a place for their services in the treatment process. There are actually many different types of psychologists. Some are academic and work at universities teaching and conducting research. Some specialize forensically, working with folks when they intersect with psychology and the law in some way. There are school psychologists who have been trained to specifically work in schools with kids. A clinical psychologist is who you typically think of in private practice, working with all kinds of folks with all kinds of psychological issues, from support for a divorce to bipolar and PTSD. Psychologists typically have doctorate degrees and a license with specialized training in intense emotional disorders and mental illness. All of the master's level licenses can diagnose and treat mental health disorders. There are master's level therapists who have varying levels of training and experience. An LCSW has a licensed clinical social work emphasis. They are usually very good at resources and are sought after in hospital settings, though you will find them in private practice as well. An LMFT, for instance, is a licensed marriage and family therapist. Their training has had an emphasis on marriage and family therapy, including work with children. They are most often called on to provide therapy when the issue is considered social or relationship-based. An LPCC is a licensed professional clinical counselor. They may also diagnose and treat folks with mental health and substance abuse issues. Drug and alcohol counselors come in all shapes and sizes of degrees. The emphasis here is usually on experience. Coaches may have had training, or they may be just working from their own lived experiences. There is no licensing board to govern coaches. Coaches may work across the United States and even the globe without oversight. Every other mental health specialist must have a license in the state they work in. The difference between working as a psychologist or LMFT and a coach is that coaches are only forward focused and don't dig up bones. We have come to believe that digging up bones is not necessarily the best way to deal with everything, particularly with families who are dealing with PTSD. We have had great success in helping families with a forward focus, and we knew that the only way we would be able to help more people than we help in our private practice was to work from a coaching model. So you won't find us digging up bones, but you will find us forging a bright future ahead for families living with PTSD. Please like us and come back to see us again.